One of the beliefs here is the magic of technology itself can somehow make providing self-insurance for these three really big companies possible in a cheaper way. Is technology the key here?
I think technology is certainly one of the keys. Customer service obviously is important, and you can't really have one function well without the other, but it's certainly been our belief and our experience that technology can drive the kind of change in the healthcare industry more broadly that we're seeing in the announcement today between Amazon, JP Morgan, and Berkshire Hathaway. So yes, absolutely.
All right, so these smart guys, I'll give them credit, Jamie Dimon, Warren Buffett, Jeff Bezos, and I thought that I figured the whole thing out. They haven't figured it out, but I've figured out what they're going to do. And now you can tell me why I'm wrong. So here's what I think might happen. That Amazon might think about, hey, we've got some licenses to provide drugs in certain states. People wonder what we're going to do with these things. We're good at delivering services and data really quickly. JP Morgan understands pricing, both what people pay and what things can cost. And they have real-time live data about that. Also what balances are across the system, whether it's how much individuals are paying or how much they've got left to spend. And then managing risk and insurance is the core specialty at the heart of Berkshire Hathaway. Do you think that's how this shakes out?
I think that's a good way of characterizing it. I would characterize it more simply as employers want to have more control over how they spend their healthcare dollars and the experience that their employees and families receive as a result of that spend. I think this announcement, to me, validates what we've been working on for the last 5 years and what we've observed in corporate boardrooms across America during that time, which is employers up to and including the C-suite are fed up with paying for a lot of healthcare costs and getting too little in return, and they want more control. And I think they believe that technology is essential in giving them more control over that experience and over that spending. So, and our success validates that.
Yeah, well, so tell me about this. So explain to us what collective health is. Give me the elevator pitch. Although if the jargon alert goes off, I might interrupt you. But please give me the elevator pitch about what you guys do.
Collective Health is a SaaS platform for self-funded employers that enables them to administer their health plans with a lot more clarity, control, and ease than they can get with a traditional health insurance carrier or third-party administrator.
So let's unpack some of that. So in terms of clarity, because I think that's one of the most interesting things about this potential of an Amazon-fueled thing, is what is it that companies and individuals don't know about their own health care?
I think it's not just what they don't know. I think it's what they don't know at the right time.
Right.
And so if you think about the systems that traditional insurance carriers are built on, they're from an era where data analytics and predictive analytics weren't really at the fore of corporate decision making. Fast forward to 2017, that is what drives most corporate decision making, that ability to predict what will happen in the future using big data, machine learning, et cetera. And so for us, we've built our infrastructure from the ground up, not just to process claims and send you an explanation of benefit in the mail, but to actually help you predict and understand what's working, what won't work in the future, right, and then to get ahead of those trends.
So give me an example, like an actual example, something that a company would want to know in time and would now know using that kind of predictive data.
I mean, I think a great example is how people are using things like out-of-network behavioral health benefits. For a lot of our customers, that's a really important thing to enable because behavioral health in particular typically engenders other use of the healthcare system that is non-essential.
Sorry, what's behavior? I should know this. What's behavioral health?
So going to see like a therapist, a psychologist, a psychiatrist. So oftentimes people might have symptoms that are really belying a behavioral health condition, but they'll go to a regular doctor or an emergency room thinking that they have a brain tumor or something far more severe. So that's a good example of using the healthcare system in a way that is very expensive to treat something that actually underlying may actually not be that expensive to treat at all. And our software helps to highlight those kinds of things and enable employers to guide their people to the right kind of care at the right time.
Is it realistic, maybe final question, is it realistic, let's imagine these very big employers of Amazon, JP Morgan, Berkshire Hathaway and all of its, whether it's Mid-America Energy or See's Candy or Geico or what have you. Can we imagine that these three companies with that limited size of a pool could actually lower health costs if they did their own program, just the three of them?
I think if they use collective health, we can definitely help them lower their costs and
sure,
allocate their spending much more efficiently than they already do.